Internships at the Virginia Department of Health forever have been very much something that people would do based on who they knew. If you had academic affiliations and colleagues at different universities, those folks would always call you up to do that, but a lot of other folks didn't have those opportunities. So we created the Internship Academy to have a skeleton and administrative framework. So we did that so that we could take the burden of administrative activities off of their plates. And that was actually really beneficial. And we used federal grants such as the workforce grant that preceded PHIG, the Public Health Infrastructure Grant, and then the infrastructure grant on the back end of that to sustain an internship academy that can go on for the next several years at least. Yeah, so we wanted to do a few things with the Internship Academy to really make it unique. One of those was how we go about the selection process. So students apply online, so of course that includes their name, rank, serial number kind of stuff, but it also includes a letter of interest. And in that letter of interest, they can't give us any information that would be indicative of who they are, names, gender, or where they go to school. They can only tell us why they are interested in the Internship Academy. And that is used to really create an unbiased mechanism for how we do the selection process. We also flip the paradigm for the interns so that they're the ones informing us where they would like to work geographically around the Commonwealth of Virginia and the type of programmatic work they would like to do. So we give them up to 3 choices for both of those things. And if they rank high enough in the selection process, then that is how we reach out to potential local health departments or central office programs to say, hey, we have an intern who's interested in your area, and we base those selections that they made geographically on that process. The Internship Academy has been much more, I would say, successful than what we ever imagined it would be up front. So we had over 400 applicants in year 1. In year 3, which we just concluded, we had one shy of 800. So we had a 94% increase in the number of applicants from year 1 to year 3. And through that process, we've had almost 1,800 applicants. We've brought in 93 interns from 38 different universities across the country. And we have been able to retain 25 of those 93 in different capacities within the Virginia Department of Health, whether those are full-time positions, contractual, or part-time wage positions. We all know from having interns in the past that it can be a bit of a burden. Just the administrative work, having to figure out what to do with our interns over the course of their time there. Sometimes it seems like a lot. So at different times, folks will shy away from having an intern for that reason. We wanted to create a skeletal framework where we took all that away from them. All they needed to do was concentrate on having a phenomenal mentorship. So at the Virginia Department of Health Internship Academy, we want our mentors to be there to provide an excellent experience for our interns. And we do that by, 1, having a conversation with all of them about what the expectations are throughout the 10-week period. And then we really encourage all of our mentors to be the mentor that they never had or the one that they wished they could have had. And that is really our impetus. And so far so good. We have had just tremendous mentorship through our program. And to be fair, we flipped that paradigm a little bit here too, because we encourage reverse mentorship through our academy. Our interns know a lot of technical stuff. And a lot of times it's more than what the folks who work in public health know. So we've had a lot of opportunities for skill sets to be shared going both ways, and everybody wins.